Hello, I'm Jessica Vasquez, and this is Candy Thurman. She's agreed to let me do a health assessment on her today. Is that okay with you?
Yes.
Okay, I've provided privacy by shutting the door here to the room. First, I'm going to start off by getting your height and weight. If you could just stand on the scale here for me. 142. You can have you turn around. You can see how tall you are. Okay, 5'2". You can have a seat back right here. I'm just going to wash my hands here with some alcohol. I'm going to start off by taking your blood pressure. Just relax that on for me. Might help if I put my stethoscope in my ears. Okay. (118/64). Now I'm just going to assess your pulse. I'm going to use this clock right over here on the wall. Count for 1 full minute. Okay, your heart rate's 72, and I also counted your respirations while we were there. And I'm now going to check your temperature. Just under your tongue. (98.7). Okay. Now I'm just going to start by just inspecting your skin, look you over, check your skin tone for hyperpigmentation, hypopigmentation, any scars, lesions, masses, any discoloration or edema. I don't see any. I'm going to assess your temperature of your skin and the texture. You're warm, your skin's smooth. I'm just going to take a look at your nails here. Look at the contour. I don't see any clubbing. I'll go ahead and check your cap refill while I'm here. It's brisk. It returns real easy. Let's do your feet. It also looks good there too. I'm going to assess your skin turgor here. It should just go right back down, and it does. So that's good. Okay, then I'm just going to start with your head and your face. I'm going to just look over, make sure everything's symmetric. I'm going to look at your hair, look at your scalp, look for any masses. Look at the even distribution of your hair. I don't see any hair loss. I'm just going to palpate your hair here for the texture.
Do you want me to take it down?
No, it's fine. I think we can do it. I'm going to go ahead and palpate your scalp, okay? Here I'm going to look for any, just look for symmetry, the size, the contour. Yours seems normocephalic. No masses or lesions noted. Any tenderness anywhere as I'm palpating?
No.
None? Okay. And while I'm here, I'm just going to assess your temporal. Can I remove your glasses a minute? I'm going to assess your temporal pulses here. Any tenderness there?
No.
They are palpable. Looks good. Also, I'm going to, while I'm here, is assess your temporal mandible joint here. Can you open your mouth for me? Okay. Does that hurt at all?
No.
Here we're assessing for just crepitus or, smooth movement. You can have your glasses back. I'm also going to check, actually, I need to remove these one more time. I'm going to check your sinuses.
Okay.
I'm going to apply some pressure here on your maxillary sinuses. Could you just tell me, is there any tenderness there?
No.
Okay, and how about in your frontal sinuses?
No.
No tenderness? Okay, I'm going to give you your glasses back because we're going to go to your eyes now, and we're going to check your eyes with this Snellen chart over here.
Oh, okay.
It's about 20 feet across the room. If you'll just stand up here, cover one eye, and read the lowest line possible that you can.
DEFPOTEC.
Okay, that's good. That's 20/20 with your glasses. And that eye, now do the same.
DEFPOTEC.
That's good. You're 20/20 in both eyes with your corrective lenses. You can go ahead and sit back down for me. And now I'm just going to inspect the external structures of your eyes just to see if they're symmetric. Check your eyebrows, your eyelashes. Yeah, you don't need those, do you?
No.
Okay. They're evenly distributed. I'm going to go ahead and look at your conjunctiva here. Just make sure it's pink and clear. Your eyeballs look glossy and white. Your sclera is white. It looks good there. No redness or drainage. Now, I don't know if I should wear your glasses for the muscle test. We're going to test the muscles of your eyes, okay? And we're going to do that first by, I don't remember. First, we're going to just test the muscle strength of your eyes. I'm going to have you follow my finger.
Okay.
Just follow my finger with your eyes only. Okay, that's good. Actually, I did forget a part. I need to check your eyes for confrontation. So I want you to just look straight ahead, and I'm going to put my fingers behind your head and wiggle them. And when you can see them, just tell me now.
Okay. Now.
Okay, your visual fields are intact. Okay, now we're going to, I'm going to check your corneal light reflex. That's just, I'm going to shine a light in your eye and just look straight at the light. I'm just going to see if the reflection hits the pupil at the same area, and it does on both sides. While I'm here, I'm going to also just check the constriction of your pupils. If you'll just look straight ahead. That's good. Okay, I'm going to do the same thing again, but look at the opposite eye for the consensual light reaction. That's good. Okay, that's good. Now we're going to move on to your ears. I'm just going to assess the ears, look for the color, the shape, any
Take
lesions.
my earrings out.
No, I think they'll be fine. Any lesions or masses. I'm going to go ahead, the skin color looks the same as your face. I'm going to palpate them. Any tenderness there?
Nope.
Looks good. I don't feel any lesions or masses. I'm going to move your tragus here. It's movable. Any pain or tenderness with that?
No.
Okay. I'm going to move on and just inspect the canals using the otoscope. I'm going to assess your canals for any redness, drainage. I'm going to pull your ear up and back. Redness, drainage, lesions. I'm going to also assess your tympanic membrane. Make sure that it's a pearly white. That one looks good. It shouldn't be bulging or retracting at all. No perforations. That one looks good. Okay, and I'm going to do a hearing test. So what I need you to do is close off one ear. I'm going to whisper something in this ear, and then you just say repeat what I said.
Bird.
Yes. Now the other ear.
Horse.
Yes. Okay, that was good. I think I'm done with your eyes if you want to put your glasses back on.
Yeah, 'cause I'm blind.
Okay, now I'm just going to inspect your nose. Look for symmetry. It looks symmetrical. It's midline. Your septum there is straight. And I'm going to palpate it for any tenderness or masses. Any tenderness noted here?
No.
No? Okay, and I just want to check the patency. So if I could have you just occlude one side and breathe into the other. Okay, do the same on the other. You sound a little stopped up on one side.
I am.
Okay, currently need some decongestants or something. Now I'm going to inspect your mouth and your lips. I'm going to put on some gloves here. I'm just going to look at your lips. They're pink, moist, they're not dried or cracked. I'm gonna pull it down here and look. It's moist and pink. Your gums look good. Can you smile and bite down? The alignment looks good there. Okay, I'm gonna also look at the inside of your mouth. If you could open up for me. Look here, that looks good and pink. No lesions or masses. No tooth disease. Could you stick your tongue out for me? Okay, and can you lift it up? It's smooth, I can see the veins. All right, and put it down. Can you say ah?
Ah.
All right, your trachea, or your uvula is midline. Tonsils are moist pink. Nothing on those, I would say a grade 1. They look good. Okay, and I'm gonna remove my gloves here and wash my hands. And we're gonna move on to inspect your neck here. First, I'm just gonna look for symmetry, any tracheal deviation. I'm gonna feel here and slip it to the side. Any tenderness there?
No.
Looks good there. I'm gonna check the range of motion in your neck. Can I have you try to touch your chin to your chest? And then look left to right. And can you extend your head backwards? Okay. And can you try to touch your ear to your shoulder, but don't move your shoulders? Okay. Now I'm going to check the muscle strength. So I'm going to hold my hand on your left side of your face. I want you to try to turn your head that way. And how about this way? And then can you shrug your shoulders? Okay. And now I'm just going to palpate your lymph nodes. I shouldn't be able to feel anything if they're normal. They should be freely movable, no painful. Here we're going to start with the preauricular. No pain?
No.
Posterior auricular? Nothing there?
No.
Occipital? No. Okay, submental here?
No.
Okay. Submandibular? Anything there?
Mm-mm.
Okay, and then here is your jugulogastric. Anything there?
No.
Superficial cervical? No. Okay, and then I'm going to check your deep chain cervical here, one at a time. No pain there?
Mm-mm.
Let's check the other side. Nothing there?
No.
Okay, posterior cervical? No pain?
Mm-mm.
And then I'm going to check your supraclavicular. Could you arch your shoulders forward? Yeah, see this little triangle here you can feel in there? Don't feel any. Does that hurt at all?
Mm-mm.
No? Okay. I'm going to check your carotid here. Okay, no tenderness there. They're palpable. It's palpable on that side. Okay, and if I may, I completely left a step out on your eyes. I didn't check you for accommodation.
Okay.
If I could have you remove your glasses one more time.
Oh, okay.
So what I'm going to have you do is just, I'm going to place my finger. Let's turn this way a little bit. I'm going to place my finger about 3 inches in front of your face, and you
Okay.
look at my finger.
Okay.
And then I'm going to have you look at an object off in the distance there. Here I'm just checking to see that if your pupils dilate when you're looking far off and constrict when you're looking close up.
Okay.
Look back at my finger. And one more time at the wall. Good. Your pupils are equal and reactive to, round and reactive to light and accommodation.
Okay.
And that completes our assessment. Thank you for working with me, and thank you very much.